Meanwhile, here in the United States, the death toll from the coronavirus has risen to 6. All deaths have been reported from Washington state, while New York City has confirmed its first case. Let's get more on this from Jeffrey Klausner, who's a professor of medicine in the Division of Infectious Diseases and the program in global health at UCLA's David Geffen School of Medicine and Fielding School of Public Health. He joins us now from Los Angeles. Really great to have you with us. Jeffrey, first of all, everything here in Washington is politicized, so the coronavirus is really no exception to that. Politics aside, how would you measure the Trump administration's response to the outbreak? Are they doing enough?
Well, the current administration, through the leadership at the CDC, has been having daily updates with information. They've been posting information on their website, and they've been providing guidelines to state and local health departments. The real response to the epidemic occurs at the local level. The authority of the United States exists in the county, and that's where the resources have to be. So the U.S. government is now taking action to help find cases, isolate cases, and find contacts.
I've heard numerous medical professionals on TV giving advice to the public. Sneeze into your elbow, don't sneeze into your elbow, sneeze into a tissue that's in your hand because the virus can live on your clothing. Hand sanitizers and masks are flying off the shelves. What are the most basic things people can do to prevent contracting and spreading the virus?
Well, the coronavirus spreads like the common cold virus. So it's spread through sneezing, through coughing, through contaminated nasal or oral secretions. So the best thing people can do is not have direct physical contact with other people. If they're sick, to stay home from work or school. And if they do have the symptoms of the coronavirus, which are either cough or fever, to call their physician, see if they can obtain a test, and if they're sick, such as they have pneumonia, shortness of breath, or difficulty breathing, then they need to seek medical attention. We do know that most cases are very mild or even asymptomatic, and the most severe cases occur in the elderly and those who are having other chronic medical conditions.
How do you see this outbreak playing out in the States? In other words, how bad do you think it's going to get, and when do you think it will die down?
Well, unfortunately, the worst part of the outbreak we're seeing now is that the fear and people's just irrational kind of concerns about their own potential consequences. What we're going to see, however, are small mini outbreaks. So like we've seen in Washington state, a small mini outbreak has occurred. We may see clusters of cases in other urban areas, but just like in China, after an increase in number of cases, we're going to see a decline. So the good news is that people who recover from infection, most people do recover from infection, they are immune to repeat infection, and it's that natural immunity that causes epidemics to go down on their own. It's also that natural immunity that we're trying to replicate with the development of a vaccine. So I do not anticipate it's going to be a major widespread epidemic. The things like we see with influenza, there'll be local increase in cases, and the cases will go down in 4 to 8 weeks.
In terms of the fear that you mentioned, people reconsidering international travel or not going to a concert venue because they're worried about too many people concentrated in a particular area. I mean, should people essentially here in the United States be going about their lives business as usual?
Well, I think, business as usual, yes, but with some caveats. If you're feeling feverish or have a cough, please stay home. Don't go to work or school. You can interact with coworkers or friends a little bit more in a modified fashion. I think, not shaking hands is wise advice. And then, just remembering about personal hygiene and sneezing into a tissue or coughing into your arm. So it is spread like a cold virus. People can also wipe down their surfaces and telephones with antiseptic wipes. Once a day is probably more than adequate, and just be a little bit more aware how respiratory viruses like cold viruses are spread.
All right, Jeffrey Klausner, really appreciate you being with us. Appreciate your expertise. Thanks for that.